Hi everyone, hope you're going well. So I just decided to shoot this quick little video as a response to a question that I've been getting quite a lot lately, which is, what do you do when you hurt your back? So most people that we treat who hurt their back hurt it in a number of different and quite unusual ways, to be honest. So it's actually in the minority where someone will hurt your back doing something really full on, like lifting a very heavy weight or in a traumatic accident. Most people will just do a movement like you sleep the wrong way, you bend too quickly, or you pick up something and you didn't know how heavy it would be, or you get a jolt. Now, people hurt their back in a number of really unusual ways that isn't really indicative of the severity of the pain that you're having. So the injury can be not too severe, but the pain can be really awful. And this is often the case because the movement that you've done where you've suffered the injury is just the straw that broke the camel's back. So muscles were getting stiff or tight beforehand through maintaining certain postures and positions and doing certain movements that are repetitive or prolonged or strenuous. And that incident where you've hurt your back has just been the straw that broke the camel's back. Okay, so let's fast forward back to you've hurt your back, you're in a hell of a lot of pain, you don't really know what to do, no positions are comfortable, it hurts to bend, so you're in a bit of a tough spot. So my recommendation is most people who hurt their back like this are going to make a full recovery unless the injury is very severe. I've seen people get better in as quick as 2 weeks, and I've seen people take as long as 2 to 3 months to recover from this state, depending on what tissues in their back might be injured or strained. But the bottom line is you are definitely going to heal. So here's some of the things you should do. So when you have this incident, number one, don't keep doing the thing that caused it. So if you've hurt your back, you need to stop, you need to rest. You need to take it easy for a couple of days. So I generally recommend taking it easy for 2 to 3 days. You need to avoid positions that make the pain worse and be in positions that make the pain better. So there's no real set pattern. If lying down makes it better, lie down. If sitting down makes it better, sit down. Do whatever you need to get relief. In the first few days, it's also really important to take medication to settle down the pain and to get sleep. So a lot of people, if the pain's really severe, you won't be sleeping well, you'll be quite disturbed and find it difficult to get in a good position, and this will just be a challenging time for you in general. So if you've got painkillers, take them. One of the recent changes that you can't buy codeine over the counter now has made it difficult for people with back injuries. So I'd recommend starting on paracetamol and potentially anti-inflammatories, but you've got to be a bit careful with these because they can affect your gut and other medications that you're taking. So I would take paracetamol, I would take it as recommended on the packet, and I would discuss with your doctor anti-inflammatories. Or if you've had this problem before, you can take them, but take them with food. If the pain is really severe, you'll need to see your doctor to get some strong pain medication. Now, I like to see people at my physio clinic 2 to 3 days after they've done this injury, as the injury has often settled a little bit, and we can start to do some physio to get your back moving, get the muscles a bit looser. Sometimes you need sports tape to give you some support for your lower back, and you need a physio to help diagnose and help reassure you as to what you've actually injured in your back and how long it might take you to get better. And of course, you'll need a plan to work out what you need to do yourself to try and help your back get better as quick as possible, get out of pain, and get back to doing the things that you love. And just as important as that, the plan is important so you know what you need to do to make this problem not come back. So the bottom line is, when you first hurt yourself, you're in a lot of pain, but you should get better with the right advice and with the right management. So that's just a little bit of a summary. If you'd like any more information, I'm up at Scarborough Physio and Health on the Redcliffe Peninsula. You can give us a call, 073 880 1649, or you can send an email to info@scarboroughphysiotherapy.com.au. if you'd like some more specific information or advice about how to help your back, or if you feel like you need to see a physiotherapist. Okay, thanks for your time. Go and have a great day. See ya.